Who's
All right,
that?
it is recording.
Ah, ha, ha.
All right, what is going
Just in
on,
the nick
people?
of just in the nick of time.
We are here with the Adam Salvatore. For those
Why,
of you who
thank
don't
you.
know him, he is my big brother. Um, he is a personal trainer, and he is on here today. Adam, why don't you tell him maybe a little bit about who you are and why you're on here today?
Well, I've been reached out by the crew over here at what was it?
Health Revolution.
It's Revolution, right?
Revolution.
Right, the Revolution crew, not the New England Revolution. Don't be confused, my friend. They're
Not the
actually way better. They're way better than the New England Revolution. I hope so, at
Ooh,
least. Yeah,
that's
that's
a
right.
high reach.
Yeah, so I'm here to talk about mainly you guys are reaching out to me, I believe, because I've recently had an injury. I've kind of I've escaped injury for the most part, but it got me. The Reaper got me this time. So I have torn my ACL. So I assume you guys are interested in talking about it a little bit. That's what I would say. But I'm in the same kind of a field, physiology, kinesiology. It's all physics, all the same kind of thing. I'm Swolvator strength. That's kind of how I go by. I want to help increase people's expectations and smash their ceiling. That's kind of my whole thing. Is smash it through ceiling. So when you think about that, when you think about houses, think about a basement. Basement to ground level. That's where I would put rehab, correct? I always have thought that I'm a little bit more on the side of where you go from that ground floor or first floor to the second floor to the third floor through into the attic, bust in the ceiling, knock the roof off. That's kind of how I like to go about it. So that's
love it.
that's where kind of my slogan and my purpose in the field kind of lies, I'd say.
Right on.
Right on,
Boom.
bro. That's a pretty good intro. That's
He also went to Springfield College, people. We all went to Springfield College.
Oh, that's right. That's right.
Another
Yeah,
connection.
I should have worked on this little elevator pitch a little bit.
Also, what he forgot to add is he also tore his meniscus. Adam, which meniscus did you tear? The medial or lateral?
I apparently have torn both. I'm not a specialist at looking at MRIs, but neither are they actually because it's
So yeah, he
debatable.
really he really messed up his
Debatable.
knee, right? So he has meniscus tears, maybe both. He's unable to confirm at this time.
Wait, you
And
wanna you wanna you wanna let us know how you had this you injured yourself, acquired this
Ah,
injury, say?
well, yeah, yeah, yeah. I don't know. How would you guys suspect that I did? I don't know if you guys see this kind of stuff a lot. Um, but I'll answer the question quickly first. I hopped in on flag football, playing flag football with my church crew. It was the old boys versus the young bucks. So we kind of, I would say, naturally have a little bit of a disadvantage against all the guys that are currently playing, varsity high school sports. They're playing, varsity football. They're on the team. We're just we're kind of living back on the glory days. So I hopped in there. I got the call up and basically was shadowing a man back there. I ran over, sprinted, got pushed, got tripped up after I kind of got pushed in like this random tornado of a of a kind of an activity going on there. Tried to track him down. After I fell, after being pushed, I popped back up. Kind of was like, where is he at? I ended up kind of just reacting, and that's when I kind of felt as I kind of pushed off and tried to cut. I felt a pop, and down all of a sudden I was down on the ground again and looking around like what's up. So that's kind of how it all happened. And just probably should be playing more flag football and more used to turf. More. I'm pretty convinced that if I were not to wear cleats, I I would be willing to bet that I wouldn't have torn my ACL if I wasn't wearing cleats. But you guys, I'm sure, have your own opinions on that, and maybe maybe you'd say I'm just I'm wrong. But
I gotta,
that's kind of how I feel on the whole
yeah.
situation. So I'm kind of a little regretful. Naturally, there's some regret that goes into play, some
Sure, sure.
embarrassment, a little bit of credibility where you're like, man, like I'm doing all this stuff and I still got hurt.
Mm.
There's a video of that, guys, too. Adam, do you have the link for the people to see the video of it happening? He showed it to me.
Oh, dude, yeah,
I,
share
I
it with
I
us.
I I don't know how easy that would be to link up, but you're not talking to the tech guy. I am not the IT behind Health
We'll see
Revolution.
if we can get it for the crew. There's
Yeah,
a
yeah,
video.
We'll
yeah.
we can make that happen. I'll just blur a
Fairly
bunch
low
of
quality
faces.
video, but it's a video.
Well, it's better than it's low. It's better that it's low quality. We'll just blur out all the faces. There's no animosity here. You know, nobody pushed anybody. I'm planning to take this thing to the highest court. That's I won't quit until I get my
For
compensation.
sure.
I got a
Sure,
follow-up question
percent.
for you, Adam.
With yeah. What was that?
So
Hmm.
this is not necessarily a physical therapy question, but more of a question I guess I would use on here. I'm just getting to the point of like from a history perspective, like walk us through your experience from that moment to where you're now, like today, because I'd love to get a little bit more of like what's been going on.
Right. Well, when I heard the pop and I fell to the ground, I was pretty sure something major or had happened. I was hoping it was like a hamstring tear. Like I literally just tore the hamstring off the bone because it felt poppy on the backside of my leg, and then I realized I don't think it's my hamstring because it probably would have. I don't know if it would have hurt more or not, but it was working enough to get up. But you could tell that there was some serious swelling and a reaction, a mini explosion of sorts in my knee. So that I kind of knew at the start. I was like, this isn't great. People were like, they went to help me up, and I was like, yeah, don't help me up. I'm just gonna walk over here. I'll be over here. Don't worry about me. Because I could tell immediately, that it was kind of something major. It wasn't necessarily a minor thing. Um, I mean, right now, I'm doing pretty well in terms of like how I feel on it. Like I'm getting a little more comfortable with it. I mean, the progression of it was like trying to walk it off. I was able to walk a little bit. There's definitely a limp, and my gait was like seriously compromised in terms of like a stride length and stuff like that. So I was favoring, of course, my left side, but you know, it could have, you'd think maybe it would be worse. I don't know. With a tear of a ligament like that, I didn't I didn't feel like I had like super instability at any point, really. I mean, I was kind of checked up and evaluated by a few different people, and there was some misinterpretation, I suppose. I guess it's hard to pick up a Lockman's test of an ACL tear, and I'm not entirely sure why that is, or if there's talks about how to improve that and how to make PT kind of be able to kind of hit the nail on the head and make an accurate diagnosis. But, I would say that would be something that people could improve on because,
No,
I was like,
he's adding me right now because yes, as his brother, he came to me
no,
and
no,
had his
no, I'm
chest
not.
me.
I'm not. I mean, yeah, with you,
You
I
don't
could
just
name a
at
bunch
me
of different
next
people.
time, bro.
I'm just gonna, yeah, that's right. That's right. Hey, no shame. It's just, I think that's the nature of injuries. They're not
Yeah.
necessarily obvious either, um, from the start.
Yeah.
I mean, I woke up after that injury. I woke up in the middle of the night at like 2 a.m. and like it took 30 minutes for me to like just kind of ready myself to like even make any move of my leg. It was like in some pretty extreme pain. Um, and that's when I knew I was like, hey, this is not something I'm just gonna brush off. I thought I was gonna be able to sleep it off and wake up in the morning and be like, it's just a little sore. And so I kind of warned the people at work. I'm like, yeah, this is not good. I'm probably not going to be in a good state. So I limped and hobbled around for a few sessions at work, and and I ended up going home pretty quickly just because the nature. It was very painful for that first couple days, maybe 2 days, and then it started to just the swelling kind of subsided a little bit, I suppose, and the limp started to disappear maybe 4 or 5 days in or something like that. I wasn't too bad, but there was definitely a little bit of a gait change. Maybe it was 2 weeks. I don't even know, but
You had about four
it
or 5 days.
it definitely started to get better, in terms of like my confidence on it. Maybe a week or something like that. Um, and now what? We're 10 weeks out at this point. I mean, it was really painful getting into 90 degrees plus and even just lying supine and getting my knee to bend, getting knee flexion about 90 degrees, and anything beyond that was pretty extremely painful for a while there. Which I don't know if that's the meniscus. I don't know if that's just general swelling. I don't know if that's just the nature of an ACL. I'm not really 100% sure, but I could tell you that, I started rehab pretty quick. I started moving around and doing as much as I could. And, I noticed that, those full extension I wasn't having much of that either. That was probably 5 degrees, 10 degrees instead of at zero, for a while. And that obviously has to do with the limp. The limp came from a lot of that as my kind of resistance to extension in that left knee.
Yeah.
Um, I don't know. And then maybe 3, 4 weeks, I started to like, see some changes in that supine knee flexion where, I'm dragging it in. It's getting to maybe 110, 120. And like right now, like it's pretty good in that position. Like there is a dead stop and a pretty hard end, or not. Maybe it's more of a hard end feel or whatever you might categorize that is, but it stops at like maybe 145. I don't know, 135, 145. I'm almost there in some respects. The other day I was doing, even though there was um there was advice not to go past 90. I was able to go past 90 on some of my I was doing Hatfield squats,
Mhm.
and I was able to go past 90 and they were feeling pretty good. What I do notice is when I get those
Ask to
days,
grass for the win.
I was doing it and it wasn't too bad. I do notice that after those days and after those workouts, the next day is a little stiff. Um, so I don't know if that's, a preview of what an osteoarthritic kind of condition would be. I don't know. I mean, clearly, I've heard that due to the nature of my injury, I'm probably going to deal with a little bit of an increased risk for osteoarthritis. I want to do what I can to avoid that, which is probably why, I'm going to get enrolled in an actual physical therapy program, and I hope you guys can help me alongside with that. I mean, I've been following pretty tightly to a program that that is rehab based, made by you guys, but I don't know, I don't know in terms of metrics and in terms of objectives and, hitting certain, you know, uh, checkpoints. I don't know whether that's one thing I'd like to talk more about is her certain checkpoints and how to uniquely determine what the checkpoint should be for each person. Maybe I don't know. Maybe that's a good thing to talk about and think on. Maybe come up with a system of sorts.
Yeah,
But
definitely.
that's your guys' job. That's
That
where us strength coaches refer out because there
as
is pain. There is pain
Yeah.
with
so so
some of the knee flexion. Yeah.
just to let we've been talking about you for a couple of weeks now, like just in that.
Wow. Honored.
Yeah, I know.
Wow. I'm honored.
We were
You're
thinking
making me
about like
blush. You're making me blush.
we were thinking about like how we can possibly onboard and help, like, offer our services to you. And one of the things, like I think Matt mentioned, like possibly looking into the difference between surgical and non-surgical options and what are the outcomes, right?
Yeah.
For someone like you who's like extremely active. You're an athlete,
Yeah.
bro.
Yeah. And Sue, one thing. So Adam, why don't you just briefly tell like what your activity level is in a week or so?
Uh, all right. So usually I like to play basketball on Thursdays. That have been ongoing for a while. I've been missing that. That's this thing I've been missing the most, to be honest. So that's been a bummer to be out of, commission playing hoops. But generally, I mean, I'm a once a week hooper. I would like to play more, but that's just the way time and the season allows for at the moment. Um, Power lifter is kind of the way I train. I train powerlifting. Haven't competed in a while, to be honest, but basically my lifts are based around the big three and a little bit of bodybuilding kind of accessory work. Um, so I mean, the biggest hindrance at the moment is my squat, and realizing that I can't really hit depth on my squat at the moment, and that's something that's I would like to see that I need to have improved, in order for me to get back to a state and a condition in which I can compete again at that level. Um, so I'm working out anywhere from 3 to 6 days a week in terms of mostly strength training under the barbell, a lot of barbell lifts, a lot of body weight, a lot of dumbbell accessory work, generalized. You know, not a whole lot of cardio. That's something I should probably get on, but I was gonna be again. I had a marathon scheduled for May. I was gonna do, I think, May 7th. It was in Maine, the Seacoast Full
You can
Marathon.
still do it, bro. Sign up.
I mean, I already am. I already am. I didn't get the insurance on it, so I'm not getting my money back. so
Oh. Oh, you were
so
already
I'm
signed.
I'm signed
Wow.
up.
Yo,
Yeah, I'm
do it one
signed
better.
up.
Do a hop on one leg for a marathon.
Maybe I should. My right leg, and who knows what'll happen to that one after doing that. But who
That's
needs, if I have
Depends on
one
the
good
tissue
leg,
preparation for that.
might as well, might as well. Who needs, might as well
yeah.
even them out. Even them out.
Oh,
if the less
that's
bad, the
wild.
Get
right's got
another,
to be
get a
bad. They
deranged
both
right
both
knee.
bad knees. That might be a little case study. Am I a case study to you guys? This isn't funny. This is my
Technically you
body that I have
are.
to live with.
Yeah.
Oh, you're
But
yeah,
no,
for
that's
sure.
that's what we were going with it, because like we were having a conversations about like what would be like doing. I don't know what you're considering or your like options for you, right? But we were looking at both what post-operative and non-operative, like like operative versus non-operative management of the your
Sure.
injury, pretty much, like, and what that would look like for you for right now, like long-term health, and like or decide to go to surgery options, like kind of like that was the one thing that we were talking about, like, and what we could possibly help you with.
Yeah, no, that would be great because I'm not as well versed in that. I don't expect to take my own program, take my own programming as my own in this sense. So yeah, this is where I refer out as a strength coach, and I you know give you guys the reins. So that's what I'd like to do.
Got
But
a question
oh,
for you.
back to it. So that's the reason I sign up for running events, because I don't really like doing cardio, and I don't really run if I don't have anything to train for. So I mean, that just goes into the whole idea of like create, performance metrics, KPIs, key performance indicators, some sort of an event that kind of pushes you, that it stems you to go and train and be a better version of yourself, and do stuff that you don't really like to do and you don't really have a proclivity to do. So, I did
Right.
the main Seacoast half last year, and I trained for it. Previously I had done half marathons and hadn't really trained for it, and they've been miserable, versus the fact that I trained for it, and man, I blew it out of the water. I did great, felt great, could have done another 7 miles, I think. That's just what my body was telling me. So there's power in training and being prepared for such an event. So I
100%.
was about to do the full marathon at the same place because it
Yeah.
was a beautiful race. Highly recommend Maine Seacoast half and full marathon. Great, just venue, great, landscape, and it was a great little party too at the end there.
Are you running currently?
I really haven't. I do notice that getting a jog going is a little janky on the knee.
Okay.
It doesn't handle speed all that well, at least from what I picked up on. Eccentrics and stuff it responds well to, but anything fast is a little questionable. I just think something must happen in my knee to kind of, I don't know whether it's my body protect. It's probably my body protecting, itself and trying to slow everything down a little bit. So yeah, running is questionable. I mean, I'd be down to try it and do it. I just don't know how good it is for it. That's why I have been avoiding it because it kind of feels like there's just a little bit of a rub. So the instability kind of does rear its ugly head a little bit more in that. So that's why
What's
I've kind of been avoiding it.
what's
I
your
ran to the
comfortability?
mailbox the other day to get the mail, and
No.
it was our mailbox is like I live in a condo unit area, so they have the little main circle over there with all the little the post house with all the little mailboxes. It's probably like I don't know, 0.2 miles. It's just a kind of a little sprint. It's like a little 400 meter or something like that, 200 meter.
How'd that feel, man?
And
Like, any buckling or felt okay?
I don't know about buckling. I don't know about buckling, but it does feel it just feels a little weird.
Okay.
It
Yo, let me ask you
it
this, like,
yeah.
day-to-day stuff, right? When
Uh-huh.
you're walking upstairs, sitting up, sitting down, all that stuff, no problem. Like that has improved significantly to a point where you're like lifting weights.
Yeah. That has improved significantly. I will say that straightening my leg fully, there's like a pretty consistent pain that hasn't really gone either way on the back side. It's kind of on that lateral aspect of my meniscus, and I don't know whether that's something that I don't know if that's one of the meniscus tears that are agitated, but I do
Hmm.
feel that I straighten my leg fully, and I start to really feel a little bit of that pain on that backside of that lateral meniscus.
Yeah.
So that's the one thing. But even like sitting and standing up from a chair, like it's totally cool. Like it really doesn't have an issue. Again, my knees at 90, my hips at 90 about, and
Mhm.
there's really no issue there. A little bit of a lateral squat tends to be a little finicky. I don't think it loves the lateral squat. That's what I've been picking up on.
Yeah. That's
Right.
that's fascinating, dude. Because like, uh, well, I guess we'll talk more about it later. Like, when we
Yeah.
discuss like what are the options like. But that's still like very fascinating to me. Like, especially after you like meniscus tears and ACL at the same time.
Yeah.
Wow.
It was funny before I had the injury. I think it was like 2 days before. I wonder how much it contributed to it. Who knows? Your body's all about managing and staying below the threshold, right? There's a threshold, volume and MRV, whatever. I mean, I don't track that very, very carefully. I don't think I just trust that, I've trained enough and I'm good. But I was doing, some of those Nordic hamstring curls that like I'm able to do them like almost.
Mhm.
I'm not as good as Tyreek Hill, but I'm pretty dang close. I
Yeah.
get all the way down. Maybe there's a little push, but I'm going chest to ground and I'm popping back up. And I'm fighting for it. Like that's some of the hardest exercises I'll do in the gym. Like that's right up there
Yeah.
with a max deadlift attempt on hamstring engagement and like stress. So I was doing that 2 days before the injury. So I don't know, who knows? Maybe my body just, you know, wasn't ready to be in in a game situation after that. Should I blame it on that? I don't know. It's probably a whole big storm of all these different key players that came into play in that one moment, the perfect storm, so to speak.
Yeah. So dude's
But
a freak. You can look at his legs if you didn't know that. I can confirm he's a freak. But Adam, so we did all spend some time kind of looking into a little bit more of research and like listening to some people who are well versed in this topic. Would you like us to share our findings on what we think about non-operative versus operative ACL? Is that something you'd be interested in?
I feel like the answer is yes. The correct answer is yes.
All
It would
right.
be very rude to say no.
It would be rude, and we'd be
Yeah.
it'd be kind of awkward. So
No,
thank
no,
you.
no, no. Of course, because I didn't do the research. That's why I reached out to you guys.
All right, you guys. Anyone want me to start here? Do you guys want to
Yeah,
go for
you
it?
Well,
guys could like go ahead and then like I'll finish it at the end. I guess like I'll
Could we
say my piece
could
at the
we
end.
potentially spend a couple minutes to address some of Adam's questions? Because there were a couple things that came up that like I
Oh yeah.
think would take like 3, 4 minutes to just like maybe discuss.
Yeah,
Um,
sure.
the first one you talked about, Adam, was like frustration with diagnostics and like getting the ACL diagnosed accurately initially. I don't know what you guys
yeah.
think.
Well, I
I
guess like
mean,
I had
Ace.
a question about that. Like you saw like obviously Matt, you checked them out too, like the knee, but you also saw orthopedic specialists and they didn't really say much, like giving you like a direct indications of where this may be until you've had the MRI results.
That is true, man. Yeah, I had a couple different people. There were at least four people that got it kind of wrong in the sense that they were like, "Oh yeah, like ACL feels good. Check it and do it again." And I was like, "All right, cool, sweet." And then this one guy gave me one heck of an eval, man. Let me tell you, he was ripping me around. He was an orthopedic surgeon, so he's a client around one of the gyms that I'm at, and he ripped me around, man. He gave me the full flexion, and I was like, ah! And then he gave me the internal rotation. I was like, ah! And he was like ripping me around. I was like, oh, oh, oh. Finish him. Oh.
What did you
And
find?
so he was like doing like aggressive testing, like very
Mhm.
forceful. And then he was like, I think you tore your ACL. And I was like, oh, you're the first one to say that.
Yo,
I
actually,
was like
thinking about
surprised
that,
and in
yeah,
agony, sitting on the table, like, oh,
I I wouldn't have like until like well my recent research on it like I wouldn't have like really thought about this but like your hamstring really does play a huge role on anterior translations, which is probably why they were like having difficulties identifying like okay like there's no positive Lockmans or like translation tests to say that you have an ACL. And the fact that he did that, that's actually perfect, actually, even though it's painful, but like really,
Swelling too, and just the fact that special tests aren't that special. We all know that, right?
right,
The
right.
MRI is the gold standard. Anything short of that is going to be flawed. I don't know the specificity or sensitivity off the top of my head. We could probably look that up, but we're trying to look at something. We're trying to assess if a structure is intact without seeing it. That's going to be hard. The people who I've felt supposedly one torn ACL on a patient who came to see me for non-operative rehab, and I would be the worst person to assess that. Now, an AT who has felt like 500 torn ACLs is probably gonna be better than me. I would certainly hope.
Well,
yeah.
I think
Well,
for the
a couple
majority,
people, yeah, yeah.
go ahead, go ahead.
I was just about to say how I've heard some people be like, "Oh yeah, I mean, I've seen the anterior translation that like it'll literally come and push the skin out kind of thing, and then go back in." I'm like, Oh my gosh, that would make me throw up if I saw that happen on my body.
Yeah, I did have like a one ACL patient that I did a rehabilitations, and like you could tell, right? It was like that. So I think that like at least for like I don't know this like you're saying like Matt like the specificity like all that stuff on that one, but like I think for a general public like they're very good at like saying that yes you have a ACL tear, but someone like you who's like your hamstrings like built like a like a log, like you probably won't be able to like able to like stay as easily. So that's where I guess like this is why special tests are flawed. Like you're saying, Matt.
Hmm.
I like that. It sounds like you saw a couple people, and that like one of them was able to diagnose you. It was interesting that it was the orthopedic surgeon.
And
Like
let me tell you, he was aggressive.
that's
He was
cool.
not babying it. Like everyone else, I could, yeah, like they were babying it. They were like, "You being careful." This guy did not. He went full tilt. And I guess I don't know. I mean, the forces that you come into contact with on the field are, probably 10 times what he applied. So,
There's not
you know what
many
I mean?
instances where I'm practicing these special tests in my clinic, which I think kind of goes to maybe for other clinicians. I don't know if that's something they see. I mean, we don't get a ton of ACLs like pre-op, not diagnosing a whole lot, but like maybe kind of shows like um, cluster tests, like doing multiple, like practicing, and I think that's important.
Yeah, I mean, it makes me think that like, MRIs are also interpreted, like nobody could there was some disparity between what, one person thought and the other as well. So
Mm.
I'm thinking like maybe it's not a full complete tear. Maybe it's not completely severed. Maybe it has a few, fibers that are still hanging on. I mean, I could see that being the case, majority of it maybe being torn, but maybe
That would have
there's
been
still
a
some stuff hanging on.
that would be
That
a
would
good
make
case
sense.
scenario.
And
That would be
then
a
what would
really
that mean? Would that mean that if it's at least a little intact, would that be more likely for it to get healed
Yeah,
and
so that would be a good case scenario because like I was looking into like the possibilities of like repair, right? And right now the
yeah.
data is like kind of like, oh yeah, this guy had like a complete repair like, and after ACL tear. But you can't like just based on like where it is, like I guess if it's whether it's like proximal or distal, if it's like a proximal tear, right? You almost like based on my understanding, like is like that like once that tear happens the ligament in itself just kind of comes back and then like kind of soaks into the synovial fluids, and therefore it doesn't really give you a chance for the blood vessel surrounding it to like allow for repair. But if you did have some sort of fibers that's still attached to it, I don't know, maybe you will have like a repair that possibility.
I don't know. Yeah, that same guy who diagnosed me with the, ACL tear, he said there's a chance it's hanging on by like, 5%, like if there were 95, fibers, there's five of them attached. He's like, there's a chance, it's not completely out of the question. And
Yeah.
he also said that, maybe my lateral meniscus isn't as bad as maybe, the original reading was, you know what I mean?
Mm.
Maybe he doesn't think it's a root tear. I don't know. There's talks about my lateral having a root tear and my medial having some sort of a radial tear in terms of meniscus as well. So, that's the other thing. Even if it was, not an ACL and it was meniscus, like how would you deal with, if you're just referring to those two independently,
Yeah.
what is your guys' general recommendation when it comes to meniscus themselves,
So I'm learning more recently that if there isn't a meniscus involved, then you want to let them heal, and that's why that they were saying like maybe don't go past 90, right? Because now you put it into a little bit more compressive force. So that's my understanding so far. I don't like have more than that really on that one. I'm treating like I know that I have like a couple of like meniscus and ACL repair, and the research around it and the surgeon what they said is like worry about getting to flexions later.
Mm.
Focus on the recovery healing first, and then progressively load into the flexions or flexions.
Right on.
Got something I want to address two more things. Uh, I thought that the test score was one thing that you brought up, and then there was two other things, and then maybe we'll wrap up from there. But I thought we were talking about like understanding timelines and understanding
Mm.
like going to see another physical therapist. Like that's something that's important too, so you can understand what to expect. Um,
Like checklists, like,
right.
I mean, I also think like, I think my return to, baseline is different from other people's, right? It just generally is, so it's unique to me, it's less of a universal standard, or
Yeah.
at least I would think that, you know, certain people, if they can get out of their chair, like that's good.
Right.
I'm like, not, that's, I can already do that. So I'm
Yeah.
already technically functional to a certain degree.
Right.
So it's like, maybe,
He wants to
if
get
I
out
go
of the
to,
chair with
if I go to
500 pounds
PT
on his back.
now, yeah, good job, grandma. Now do it with 500 pounds on your back. And then just watch her just dissipate into a
Right.
cloud of dust.
Sorry, Grandma. He doesn't mean that.
So it is kind of like a very one
Sorry, grandma.
N of one, like very unique to everybody kind of thing. I mean, like PT, like that's so cool with being in the clinical setting, or like if you're working with strength clients, it's like everybody's different. But I
Right.
think we
True.
did talk a little bit about that because I think some of the research we did this week might have looked at like metrics and timelines, non-op versus op.
Yeah,
But
I mean, but you guys are in kind of like currently where you're at, like you're based on insurance, right? And insurance has their own
yeah,
Right.
standard, correct? So you're kind of, that's why I'm saying like, why is it universal? Like, I'm not done with PT until I can do this certain thing, right?
You know
I
what's
don't know.
crazy? Even that is that like when you do finally seek out physical therapy, right, to go to places, your insurance may not even like cover it just because how functional you are, because at the like that's
That's
what
what
they
I'm saying.
care about, right? And so you may need they may only approve for like a couple of visits, but rehabilitation is a very long process, right? And so it's not gonna be like, yo, a couple of visits you'll get healed, and so based on how functional
Right.
you are, like how active you are, they're gonna say like, nah, dude. We're not gonna cover you.
Right. That's kind of what I'm thinking is going to be the storyline, which I don't agree with that storyline.
No, we don't either. And I think one of the reasons why we're trying to like do this here is so that we can be that person for you, right? When the intern's like, all right, we're not doing it, like we're not paying for you to go to rehabilitations, where we are here for as a support person, right? If you need anything from us, or like if how can I mean you're a strength coach, you know everything about strengthening, right? And so, but how can we tweak things, right, to
Right.
be more optimal? It's like, what does the research, current literature says, and certain approaches and things like that. So I guess that's where we would kind of come in more. I don't know if you guys would agree with me there.
No, I agree, man. I don't have much to add.
Yeah.
Right.
Yeah. Um, Anthony, you said you had questions about like matrix and timeline.
yeah. I just thought it was important to add that like so one of the I actually found a case study that followed an elite footballer, like Premier League athlete, who went back to sport after, like, I don't know, it was like something crazy, like 8 weeks after an ACL rupture, which I think is like,
I heard that, yeah.
yeah, I need to look into that a little more. Um,
Personally, I honestly think I could play basketball right now. I'm not gonna lie.
yeah, that's kind of
I
one of my
could.
questions I had earlier for you too, because it's like, there, it's so unique to everybody. You're already doing like phenomenal after this injury. And like getting back into your strengthening and your routines. But it's like it's uncharted water as far as like
Seems
and
like.
a non-op like ACL recovery goes. And it's been done. I think one of the things that I wanted to just address from like timelines and metrics is just that like when you go in like a operative ACL is just that's one of the benefits of like it's been done so many times. You have these benchmarks and you know like what kind of what you're hitting. There's a lot of
Right.
research out there. It's just that's kind of what I was.
Yeah.
Yeah, I'm with you. Yeah.
Yeah, in that why don't
I
we
can,
transition into findings though? Like, 'cause, like I feel like this is like a perfect segue into like what we found. You know, Matt, maybe you want to start first because
yeah, I mean, one thing, Rainey, like, do you want to do this now? It might be a little rushed if we're trying to end it. Okay.
Nah, take your time. Let's do it.
The one thing I will say about timeline is Mick Hughes is somebody who knows a lot about ACLs and non-operative. Um, and his general thing is, unless you're like a really elite athlete or you're younger athlete, usually you can wait around 3 months or so before making the decision to get surgery. Adam,
Yeah.
you're getting close to that because it's
Getting pretty
mid
close.
December.
Yeah, it's true. Well,
Um,
I also, another flaw in the system is like, I called like, I handled all this stuff pretty quickly. I got, on track for the MRI within like a week. I think that Friday I was already in at the orthopedic specialist getting a scheduled date for the MRI and had an X-ray. So that was 5 days in. And then, the MRI was scheduled after that. And that was like, I don't know, probably 10 days or 2 weeks after that. Maybe, yeah, probably closer to 2 weeks. Um,
you're
and
lucky you got
then,
an MRI
I
that
think
quick.
I called for PT right after I got a slip from the doctor. She said, yeah, go to PT. And, she wrote me a slip, and then I went and I tried to call I only called one place. So, I mean, that's partially on me too, but they were booking out already till March 7th. So it's 2 months out. And I was like, that's my first eval that I get
that's
2 months out.
wild.
Like, if I was like, completely useless and like, distraught and, unguided, I wouldn't have done anything for 2 months,
Yeah.
and that's not
Yeah.
the thing to do. But
Right.
luckily, I've got, guys like you, and, I'm not going to take that as a cop out. I'm going to train what I can. So that's what I've been doing.
100%.
It's been
Yeah.
different. It's been a little painful. It's been a little bit of a game of, trial and error
Right.
in a way,
Yeah.
but, careful, calculated trial and error. And,
Yeah.
that's the road I've been on. But if I did 2 months of nothing, I'd not, I probably wouldn't be in a great place. I wouldn't think, I'd be starting to lose a lot of strength and muscle mass too. And, then you gotta compensate for that as well. So, that's another part of the system where I'm like, where's the help? Like,
All right.
Yeah.
So why don't we get into findings a little bit?
uh,
Um, so I looked at a couple of articles as well as just listening to, again, people like McHughes and Adam Meekins. They talked a little bit about it. Just something we should start off the bat is we're going to be using the word best available evidence a lot. That's because this is something that there's a lot of unknown with it, a lot of uncertainty. I don't think we have a lot of great evidence for any recommendation that includes surgery, right? It was just something that is assumed people have done, and then we started to question it, look into it a little bit, and it is still pretty new. One article I looked at was from the British Journal of Sports Medicine, and it was a group of, a bunch of surgeons and physical therapists. And they basically, it was a pretty cool article. They asked them questions about whether they agree or disagree. One of them was, right, so for Adam, right, we're considering his activity level and then also the fact that he had a meniscus injury. Again, one of the shortcomings is with the research is there's not a lot of research done on people who have torn their ACL and with meniscus, and who manage that non-operatively, right? So we don't have a lot of evidence to support that. What these people said was if you have a repairable meniscus, they pretty much all agreed that you would be better with surgery. So that was one thing that
uh,
pertains to Adam. And then the other thing was if you're in a sport that pertains to cutting, um, jumping, spinning, whatever, cutting, like sports like basketball, soccer. Um,
Saquon, Salvatore.
Yeah.
Man's gonna be doing some ballet out there.
but for people in sports like that, they pretty much all agreed. I think everyone agreed. Yeah, 23 out of 23 agreed that you would do better with operative management rather than non-operative management. Whereas people in straight line sports, whatever, like running, right? So runners, like powerlifters, people who aren't doing that cutting sport, non-surgical is an option, and they all agreed on that statement. However, in another article I looked at was like a systematic review um, about the returning to high level activity with surgery being recommended. They said we have very little evidence to support that statement. So yes, all the smart people agreed on that, but we don't really have much data to support that claim. Um, so those are like my main findings. I think that's most of it. I don't know if do you guys want me to run down everything, or do you guys want to add like maybe arthritis? Because I think that's a concern for Adam as well.
Yeah, I could talk on that
Yeah.
later.
Yeah.
Anthony, you
If
want to
you want
add
to
on to
cheat,
that?
hey, sign this and sign yourself up for arthritis in 20 years. Yeah. Don't really want to sign that. So to be honest,
Yeah.
rather not banging down the door to sign that one.
You guys want me to
And,
take that or?
Anthony, do you want to say something? Because like I think I have like other things that I want to add on to which to kind of build up on Matt's point.
Sure. There was a study I found kind of more along the lines of what Matt was talking about. They compared patients. They had a pretty large population. It was like 138. No, this one was I want to say maybe like 60 people, and they compared people who had surgery and didn't have surgery, and they had to follow up at like um, it was like 5 to 7 and 10 to 13 years. Um, and they kind of found that there was people who were participating in pivoting sports, soccer, basketball, that there was more OA related changes only in the non-operative group.
Mm.
Which, I mean, there's a lot of other findings that could be coming from this article too, but that one was relating to OA. I thought it was kind of appropriate to share.
Yeah.
Well, I
Um,
mean, if you think about it, if it's unstable, there's probably mini micro shifts that go on, right? And those mini micro shifts probably create a little bit of inflammation. And what is
yeah.
osteoarthritis? Is a little bit of inflammation. So it's probably, yeah. I mean, that would make
So
sense.
I'll build up on like both of you guys a little bit. 'Cause so I went in a route of like prognostic like the factors and whether like I guess what is the criteria for to look into to opt into surgery or not. And so essentially the rationale is like pretty much like what they're saying, right? Like if you are a high level athlete that wants to do a lot of cutting and things like that at a multi-directional things like that, then yeah, surgery is a better option. And plus that we know what are the outcomes of surgery, right? But there's this thing called the copers versus non-copers, right? There's this things that where essentially couple of things that makes a big difference is like whether there's instability in like your daily livings, right? Like walking, lifting weights and things like that. Whether you have like that anterior translations or like knee buckling, things like that happens or not, right? So if you ever feel
Right.
that way, and that would be an indicator to like, okay, maybe we do like look into surgery, right? On the other side, like hamstring strength also makes a big difference too, which supposedly like that if you train your hamstring and the hamstrings are strong enough they could technically act as like a the ACL for you pretty much to prevent the anterior translation, right? So which is pretty crazy to think about because I didn't like this is why I was like, wow, it's pretty fascinating thing. And there are been cases like athletes that have played sports and things like that after their ACL injuries, and then they kind of held off on surgery for like a couple of years, right? Like 2, 3 years, and eventually they did decide to like get surgery because the outcome of that is like we know what the outcomes are. Like we know what can we do to get better. right? And but not saying that you can't manage it. The consensus are like what we just talked about, but there's also a lot of like current evidence or current literatures like does not really say a whole lot of that, especially being that not only do you have ACL injury, you also have meniscus as well, right? So that's another factor to like kind of consider. In terms of like long-term health and things like that for like arthritis and things like bruh, you had an injury, and that is the greatest predictor for arthritis. Like whether that you had surgery or not surgery, and I think that's a pretty like the consensus is pretty like along the line of it. Like in I guess in this field that if you have an injury, that's a great predictor for the arthritis. However, here's the thing about arthritis though what you are imagining it as arthritis versus a non-active individual's arthritis is very different because you're a highly active individual, so you could technically regress your progression of the arthritis, right? And you can prolong it for a longer period of time versus someone that does not like that aren't active, that doesn't like, do a whole lot of strength training, a whole lot of like load bearing stuff like that. So therefore, like, you're looking at like yes, 10 years, 10, 20 years, or like, even when you're in like 50s, right? Like, like you may be better off than someone that didn't have an injury, right? So this is kind of out there. So like you don't necessarily, so what I'm saying is like you don't necessarily have to worry about arthritis because we're gonna have arthritis regardless of it. You may be in a better position just because of your lifestyles and like things like that, right?
Yeah,
Right
yeah.
now, the systematic
That's
reviews
the
that
goal.
shows like 5 years and 10-year follow-up, and that's pretty much what we got right now. 5 to 10 years follow-up, like longitudinal studies, which essentially says like, yeah, like post like reconstructions versus non-reconstructions, like it's about the same, and it doesn't really change.
True.
But I think the biggest question that like you want to ask yourself whether you're going to decide to, like choose go through surgeries or not is like, how do you like, do you want to take a risk of, you know, re-injuring yourself like while playing basketballs and things like that, right? Especially given that you already have meniscus injury. That was another thing. If you just had ACL injury and then you chose to not to reconstructions, you had an increased chances of tearing a meniscus. Meniscus was a big thing, right? But you already have tear on both of them. So I guess that's something to consider. Yeah.
Yeah, yeah. No, it's true. Yeah, that's what I'm trying to, you know, work through myself. You know,
Couple
I don't
of
want to give up basketball completely and like kind of live in like this
right.
really, babying my body kind of a space. I don't want to baby my body
Yeah.
quite yet.
Yeah. I
So that's
think I,
kind
I
of where
heard
I'm.
I heard you say that like you may be like starting to like experience some atrophies on your like your quads and hamstrings and things like that. Uh that may be something to consider because like I mean non-operative management essentially says you have to train yourself where you don't lose muscle mass and things like that, right? And so
Yeah.
that would be your strongest supporter. Um, and we already know the outcomes of it, what with the operative like health pretty much. But I guess something to consider is like maybe you guys would want to build up on more on this, but like like the risk of surgery, right? That's I mean, even though it is like ACL repairs have been pretty much like, I guess, perfected at this moment, right? It's one of those most common surgery that's been done. And we know that rehabilitations are usually good if they did the surgery well. The rehabilitation is really good. Like we all have patients that within a 4 or 5 months, they're already like jumping, like doing a lot of lateral movements and running. And given your mentalities and your positive outlook on rehabilitations, that you could technically, benefits from like surgery, not pushing you towards one direction, but that's what you want to look at it.
Yeah, totally. Yeah, I mean, I know one of the questions that I was curious about is like, when you have this graft done and wherever graft you decide to take, like, is there an expiration date, like on it? Like, does it just last? Does the tissue stay viable? Or, or is it like, that kind of thing that, oh yeah, yeah, every 10, every 15 years, yeah, the thing kind of gets a little brittle and then it, eventually it breaks again. And then you gotta go and find another graft and do that whole process again. I don't know if, I look at it a little differently if that's the case, or does that
Right.
repair last until, there's I mean, you can't really prevent a traumatic happening. It might happen. You're probably more of a risk
Mhm.
to make it, have a repair, to have a re-injury, so to speak. But, will that repair last as long as, you
Right.
keep, the stresses on it manageable?
Um, Matt, do you want to speak on that? Because like I know you've talked about it before, different types
Yeah,
of graphs.
I don't know anything about graft viability, so I'm not going to speak on something I don't know.
Okay.
Yeah. So,
I
That's a question for the
so
surgeon if you see him.
yeah, but
yeah, I mean,
I would
I called, I called and I'm looking to hear back from the surgeon any day now.
oh
So
okay.
they should
Let
be
us
answering that
yeah.
question. I'll let you know. I'll let you know what they
Let us
say.
know how that goes. But like what I would think is like this is just me like thinking out loud, right? Is that it's not like joint replacement, which joint replacement just because it's artificial hardware that's been placed, right? And so there are certain timelines that your body will eventually like, like yeah, that's it, right? Since
Yeah.
majority of the ACL reconstructions and things like that happens using your own tissue, right? Uh, as long as the non-traumatic injury happens, right? As long as there's no traumatic injuries, like that shouldn't be an issue, is my
Right.
understanding it, but this is me thinking out loud.
I agree. Biological plausibility, my thoughts would be like, or like I don't know. I think that the body would kind of take that graft and make it stronger with time. I
Yeah,
think that's kind of what I'm thinking too, Subha. And
yeah. That's my head goes like this is because you have your own tissue as a graft, so therefore your body is less likely to reject it and they different like patella graft versus like something like that. They has like a different better outcomes than not than the other ones like hamstring graft or whatever. Um so but no,
Mhm.
I think that's pretty much like where my thoughts are. I don't. Do you guys? I would be like love to hear from like what your surgeon says, like on that
Yeah.
topic
Yeah.
specifically.
I'll certainly let you know because they should
Yeah.
be getting back to me because, I'm at least getting in line and getting the schedule or was
Right.
thinking about, where they're scheduling out to in terms of surgeries. So,
Right. Yeah.
so I'm looking at that. But first I want to hear the answer to that question of like, do they
Yeah.
last? And I don't know. We'll see.
Yeah.
We'll see.
Yeah.
Yeah,
Do
'cause,
you have?
I had originally thought, it was going to be, a bone patella bone graft, and then he kind of said, "You see this? You look at this. You see this on the MRI?" And he kind of pointed out that I have some tendonitis, so he kind of wanted to steer clear of bone patella bone. So he was like quad graft. So kind of threw me through a little bit of a loop because I was like,
Yeah.
oh, I thought, I was kind of sold on a certain graft. Now it's
Mhm.
quad graft is the, suggestion is, what he recommends. So just kind of got a little bit thrown off by that. But, I'm getting more comfortable with it because I'm seeing that there's good, outcomes with that as well of recent.
Yeah. I think there's a good outcomes for both. It's just like I think one had better outcomes than the other one, just in terms of like how quickly people were recovering. I don't think it has necessarily to do with like the probability of you tearing. But I could be wrong. I could definitely look more into it and like we could look into it and then we can let you know like how uh Matt, you're about to
Yeah,
say
yeah,
something.
We, I feel like we should definitely wrap this up soon. Because
Yeah.
I was gonna add something about hamstring graft, but I think that can wait till another time.
Yeah.
all right,
to
fine,
be continued.
fine. Well, there's a
To
couple
to be
different graft
continued.
options.
Yeah.
Yeah, why don't you come back to me with your experience and your outcome, your experience with certain outcomes of said graft,
Yeah,
hamstring, quad, bone, patella
right.
bone. And we'll see how they each differ. And
Even tissue viability, that's something that we could look into because, like, I'm sure there are plenty of like literatures out there. Hopefully, there's like how long it lasts. We can definitely go follow up with this, like, because I think that'd be pretty interesting to know, right? That's a great question. Do
yeah,
you have like any other questions that you want to ask? Because like I know that we're kind of coming towards the end. Like,
I mean, no, I'm pretty good for now. You guys did a pretty good job of answering some of the questions and directing it a little bit. It sounds like we'll continue a little bit of this, and this will be a ongoing thing. I know it'll be ongoing for me. So
yeah. We'd definitely this is one of the things like like we were mentioning that like we'd love to continue because like we don't know what the just based on the nature of the healthcare fields and like the insurance and things like that, like it can get very weird. And so this is where like we want to be a resource for you, right? To anytime you
yeah,
have any questions. What we've done with our previous like another person that we like we're working with I don't want to say client, but like this is something that we initially were trying to do is we started this or Anthony started this a group chat pretty much for us, right? Where we're talking if you had any question just kind of communicate between all of us, right? And say that hey, this is what I did, or like hey, this is what the questions that what's popping in my head. And so like where we can like talk to each other and like we'll follow up. I don't know if you're okay with it, like we'd love to follow up like periodically, like probably like once a month or something like that, just to kind of be like catch up, like, hey, what's going on? What did you decide and things like that.
yeah, man. I'm in. I'm into that.
Yeah,
Yeah.
sweet. Any last minute things you guys want to add on to it or
No, I
uh,
think we're good. Thank you,
Good.
th-
Adam.
yeah. Thank you, Adam. I
You're welcome.
we truly do appreciate like you coming in. I appreciate it.
No, thanks for the info, guys. Look forward to continuing this. Let's conquer this ACL thing.
Yes, yes, sir. I'm gonna hit a pause record.